Hello, and welcome to H&HN's continuing coverage of the 2012 Most Wired Survey. I'm Hayden Bush, Senior Online Editor for Hospitals and Health Networks magazine, and I'm joined today by Susanna Hapsalan, H&HN's Senior Editor for Data and Research, to look at some of the changes to the annual survey, which helps hospitals and health systems measure their progress in the implementation of information technology. Susanna, thanks for joining me today.
Thank you, Hayden.
So, Susanna, I understand that this year's survey includes some new areas of focus around social media. So what's been added to the survey in that area?
Hayden, this year we were really emphasizing patient engagement and social media. We're looking at all types of social media, whether it's YouTube, Facebook, LinkedIn, Twitter. But we're wondering, how are hospitals using social media with patients, the consumers, and the public at large? Are they using it just for hospital information, for events at the hospital, or are they starting to use it for patient education, physician education, and chats with physicians? Last year, we saw social media playing a big role in crisis communication. So when a lot of communities were devastated, social media became the main way to actually triage patients to the appropriate care setting to find out what's still standing, where can they get care that's appropriate for their needs.
So it sounds like it became a real way to communicate with patients. And along those lines, I understand the survey's also got some new areas of focus around patient portals.
Yeah, the patient portal is going beyond the place to update health information or to schedule a visit, pay a bill. Now it's becoming the way to conduct clinical transactions and to access clinical information. So we're anticipating that in the future, patients are going to be not only just requesting their electronic health information, but being able to access their last visit, their last admission to the hospital, and even the full medical record.
Now, I imagine that putting that into place is also going to involve some security measures, which the survey is looking at.
Absolutely, Hayden. One of the biggest concerns that the public at large has is about the security of patient data. So this year, we've really beefed up that section of the survey on the security measures, and we're looking at intrusion systems, audit detection systems to really determine, has someone violated the patient information. And so that's a big focus this year, and it'll continue to be a big focus in the future.
And shifting gears a bit, I know one of the really big IT issues that hospitals are facing right now is figuring out how to communicate with physicians and other providers across the care continuum, especially with accountable care and physician alignment. How does the survey address this?
You know, we've added quite a bit to the physician portal this year. In the past, the physician portal was always a popular way to complete and sign off on the medical record, and a little bit of other transactions were conducted there. But now we're looking at conducting all kinds of transactions, but not only within the organization itself, but with other providers. So let's say a physician wants to order rehab services and schedule them. So actually doing that with the rehab provider or with a skilled nursing facility or a home care provider. So all of those transactions are going to be broadened to the other providers and even other physicians and other electronic health records within the community.
And finally, Susanna, how is the survey addressing the Stage 2 meaningful use requirements?
You know, some of what we've already discussed about patient engagement and really involving the physician more and expanding the reach to the broader community, those are all part of Stage 2. But also there are some additional requirements in Stage 2 where we're looking at beyond medication order entry, looking at lab and radiology order entry. So those are also new components that are on the survey this year. So we're not only refining what's going on in the hospital, but what's going on with the broader community at large.
Well, Susanna, thanks so much for joining us today.
Thank you, Hayden. And I'd like to encourage everyone to participate in the 2012 Most Wired Survey. It's not only a way for organizations to measure their progress in IT strategy, but also for the healthcare field to understand what challenges we're still facing and what progress we've made.
Well, it should be an interesting survey this year.